Hello and welcome to another edition of your health program showing on the Unity Station. My name is Deborah Nimi Usman. Today's topic centers on heart attack, one of the cardiovascular disease. And also on the program, we have feature, interview segments, health tips, and feedback segments. So keep watching. We'll be right back. Welcome back. The case of heart attack is increasing globally, and Nigeria has its own share. Let's take this feature on challenges that confront heart attack.
Heart attack is one of the cardiovascular diseases in the human body. It accounts for about 80% of death in cardiovascular diseases.
When you say cardiovascular disease, you mean the diseases that affect the heart and blood vessels. What are blood vessels? They are those pipes that take blood away from the heart or take blood to the heart. Anything that would tend to damage them, damage the heart and those pipes or vessels, that's what we call cardiovascular disease.
The disease is more prevalent in developing countries such as Nigeria.
It's increasing. We used to think that these problems are not here, but from our experiences so far, we have observed that many more and more people are having this the heart attack, what we will call heart attack really. It's really getting more and more of a problem in our society.
One of the major issues in heart attack is that it sometimes leads to sudden death, a situation where the victim collapsed without any prior notice. Worried by this increasing rate of death through heart attack, experts are of the opinion that there are existing challenges in our society which causes heart attack.
This year's conference, The Heart in a Changing Environment, you agree with me, is timely in the present day Nigeria, Africa and the world. There is change all around us. I mean, the change mantra is everywhere. Whether it's political, environmental, climatic, social, demographic, financial, just name it, there's change around us. And some of these changes will impact the cardiovascular system negatively, either with the emergence of new risk factors or interaction of old risk factors with the changes that we're talking about. And the political instability that is all around us will also affect the pattern of cardiovascular diseases. The change in the financial muscle that our patients have will also affect the quantity and the quality of health care they can purchase.
The environment is changing. There is a lot of air pollution. There is global warming. And these are physical environment that is changing. Also, the social environment is changing. There is a lot of crisis, both within and outside the country. And all these things affect the heart.
Added to these mentioned challenges are the presence of other diseases that predispose one to heart attack.
We know the cardiovascular risk factors are increasing. Even some of the things I mentioned, directly or indirectly, would have some bearing on these cardiovascular risk factors, increased incidence or prevalence of hypertension, diabetes, obesity, physical inactivity. These are the things that affect cardiovascular health.
Now, cardiovascular disease, they don't just occur on their own. There are certain things that will cause them. One of them is high blood pressure. Another one is diabetes, when there is too much sugar in the blood and the body cannot use those sugar very well. Another one is too much fat in the blood, not the fat on the skin, but we mean fat in the blood. Another one is smoking. Another one is taking too much alcohol. Another one is not exercising.
However, if our hearts can be threatened by social politics, economic and environmental changes and other diseases, what hope do we have to combat and control the disease?
The reassuring aspect in all this is that most of those changes that are posing cardiovascular health challenges can be controlled. To achieve any meaningful success in containing these emerging threats, there needs to be collaboration between all the sectors of government. There must be synergy between the health ministry, and other relevant agencies, environmental, mines and power, infrastructure, and financial sectors, and the population was to be carried along in whatever policies we're making. For the specialists in this house, in this room, in addition to spending time in the healthcare facilities mending the already broken hearts, we must get involved in politics, not necessarily partisan.
Public health education, and that is what we have continued to do. We continue to encourage people to research on some of these things, and that's the essence of this conference, that people, researchers, experts in cardiovascular field, as they conduct research in these areas, we discuss and rub minds together to have solutions to some of these problems.
So how can we bring it down? We can bring it down by bringing the message to the people, either through the radio, like your NTA. You can help us invite experts in this field to educate the people. We have done such lectures before, and some people have come to meet us in the hospital and say, oh, I didn't know I had this problem, but after listening to your talk, oh, I know, and they got some solutions. So educating the people, making them to know what to do, what to eat, and educating the people also on need to exercise so that they don't add too much weight, because when you exercise, blood flows through all the body. It makes even what is not needed in the body, you understand, to be removed in a way, because it causes you to circulate blood onto all parts of the body, and it reduces weakness. Some people wake up in the morning, they are so tired. That is because they don't take time to exercise, so there is not enough blood flow to their muscles, circulation of blood to their muscles. So those are the things we can do. So making people realize the need, to take care of their head.
While Nigerians are expected to imbibe these health practices, there is need to also understand that a healthcare system with available emergency units for prompt response to heart attack will go a long way in saving the lives of Nigerians.
Inclusive private sector participation in healthcare services is key to good heart care. Dr. Oladipo will talk to us on heart attack.
What are the types of cardiovascular disease?
Cardiovascular diseases are generally diseases that affect what we call the cardiovascular system, and some of these diseases include things like heart attack, stroke, peripheral arterial diseases, amongst others. Basically, they are diseases that affect the vessels or the heart. So anywhere in the body where you have vessels, when the vessels get damaged, they can actually cause problems. So if it happens in the brain, then it's called a stroke. If the vessel is damaged in the heart, then it's called a heart attack. If it happens in other parts of the body, maybe in the legs, it could be called peripheral arterial disease or peripheral vascular disease. But basically, those are the ones affecting the vessels. There are some that will affect the heart directly as well. And together, the heart and vessels come under what we call cardiovascular diseases.
What is the difference between heart attack and cardiac arrest?
Heart attack is one of the cardiovascular diseases, like I said earlier. And basically, what happens in heart attack is that there is an occlusion of one of the vessels, blood vessels that supply the muscles of the heart. And if that artery gets occluded and there is no way for blood to pass through that heart artery, subsequently that part of the heart, that muscle that artery supplies, subsequently dies. And so we say that somebody has had a heart attack. In medical terms, we call it myocardial infarction. However, sudden death, cardiac arrest, is a broader term that encompasses many other conditions which could make the heart stop working. Heart attack is just one of the many causes of cardiac arrest.
Can heart attack lead to death?
A heart attack can lead to death. There are different, in medical terms, we call it myocardial infarction. There are different types of myocardial infarction. But be that as it may, to just answer your question straight, yes, it can lead to death. Sometimes it can lead to death even with the best of facilities. Sometimes with the best of facilities, the patient can be saved.
How common is the incidence of heart attack in our society?
Unfortunately, in this part of the world, we don't have enough data for me to put it in a statistical manner that yes, a certain percentage of Nigerians are having heart attack or dying from heart attack. We don't have that data yet. It doesn't mean we are not going to have it soon, because there is a program going on now which is called RACE Nigeria, which is a registry for coronary artery disease in Nigeria. It's going on now. We are collating the different centers that manage these cases are corroborating and sending their reports to a registry, which hopefully soon will be published. Then we will be able to say exactly what percentage of Nigerians have heart attack. But be that as it may, we know now amongst cardiologists that are practicing in Nigeria that the rate of occurrence of heart attacks is gradually increasing. And in the past, maybe like 6-7 years ago, where we could hardly find one case of heart attack in 6 months. Now in a month we could see 3 or 4, and even depending on the center, it could even be more. So generally, we now know that even though we don't have a specific figure, but we know that it's gradually becoming more common in Nigeria. Recently, somebody put it like by saying that before now we had to battle with the problem of what we call communicable diseases, like malaria, HIV, tuberculosis. But Nigeria is gradually transiting from not just battling communicable diseases, but also having problems with non-communicable diseases, one of which is heart attack. Others could be hypertension, diabetes, strokes, obesity. These are non-communicable illnesses which are gradually becoming more prominent amongst Nigerians. The prevalence are increasing, and as it's put, it's like having your 2 legs previously in a frying pan, and now we are putting the other leg in fire because we need to do something about it before it gets out of hand.
What are the risk factors of heart attack?
These risk factors are many, but basically they include things like obesity, hypertension, cigarette smoking, diabetes, inactive lifestyle, excessive alcohol ingestion, amongst others. We know that people who have some of these risk factors have a higher predisposition to having heart attack.
What are the symptoms of heart attack?
Talking about signs and symptoms of heart attack. First, the ideal thing is to prevent. We don't want to wait till you have signs and symptoms, till anybody has signs and symptoms of heart attack. I mean, by the time you have the sign and the symptom, it means you are already having an episode of heart attack. And like I said, having an episode is not what we want, because even at the best of facilities, sometimes, in fact a number of times, you still lose the patient once the patient has a heart attack. So the ideal thing is to prevent signs and symptoms. We don't even want anybody to have those signs and symptoms. But if by chance that happens, the common symptoms of heart attack is chest pain, what we call retrosternal or central chest pain. The pain it comes in different ways. It could just be, it's usually severe, to the point that the patient might not be able to do anything at that time. But sometimes it might even be like a dull ache, or like an heaviness, as if somebody has put a weight on somebody's chest. Sometimes in some people, much more so in women, they might not even have this chest pain. Sometimes it looks like they might even feel as if they are having like an ulcer, a peptic ulcer, a burning pain around the upper part of the abdomen. We've seen a number of people who present days later after having a heart attack because they have been treated for peptic ulcer somewhere before they eventually present and we find out that they've had a heart attack. Sometimes also people could just suddenly feel lightheaded, they could sweat excessively, they could feel weak as if they are going to collapse. These are some of the ways that patients could have, the symptoms that people could have. Sometimes when the pain arises, it could go towards the neck, it could go towards the jaw, it could go towards the left shoulder, the left arm, the inner part. The pain radiates in that manner. But this is not what we get all the time. Sometimes, like I said, it can be vague. It can just be some abdominal discomfort like dyspepsia, and it could just be some excessive weakness and tiredness or difficulty with breathing.
What is the diagnosis and treatment of heart attack?
Diagnosis, fortunately, now we follow what we call evidence-based medical practice. So there is nothing we do now that should not be backed up by evidence. So depending also on when the patient arrives, depending on when we meet the patient, usually the test we will do will involve an ECG, which is electrocardiography. It will involve some blood tests, in which we will check for certain chemical substances that the heart will release when that attack is happening. And if those values are high, if those substances are high, then we know that it must have been due to a heart attack. Apart from that, we can also do other things like coronary angiography, or what we call cardiac catheterization, and other things like cardiac CT or cardiac MRI can be done. But commonly in most hospitals in Nigeria, we can do ECG, we can assess for the chemical substances, for instance troponin or CKMB, and sometimes we even do echocardiography to assess the walls, the muscles of the heart that have been affected. Again, I'll say that the idea is not to have an attack, because once you have an attack, it becomes an emergency. And like I said, it comes in different forms, but largely, in simple terms, there are two types of attacks. There is what we call ST elevation myocardial infarction, and there is what we call non-ST elevation myocardial infarction. That is easy to differentiate. Like I said earlier, ECG is one of the first tests we do when the patient comes in. That ECG tells us immediately whether the patient has the first type, which is the ST elevation type, or the non-ST elevation type. If you're able to do that, then the management follows depending on which line the patient comes with. That is one. However, because most patients will come as an emergency, most patients we see them as an emergency because they will come in, they can't breathe well, they still having the chest pain, their blood pressure could have dropped, they might be unconscious, they might be hypotensive. We need to first resuscitate them. So we go through the list of activities we do at the emergency to resuscitate the patient, and depending on when the patient presents, because managing them at the emergency is one aspect. Hopefully we're able to resuscitate the patient. Then the definitive treatment is the second aspect. Now, depending on when the patient arrives, there is a window period during which, if a patient arrives within that window period, much more can be done for that patient. But the unfortunate thing is that most of the patients we see in Nigeria arrive way after the window period, and as such, there is not much we could do after the resuscitation to help the heart regain its function. And that is the definitive treatment. In the definitive treatment, if the patient comes in within a window period of maximum 12 hours after the onset, the best is within 6 hours after the onset, but maximum 12 hours after the onset, much more can be done to help that patient. But if the patient comes in a day after the onset, 2 days after the onset, if we are able to resuscitate the patient, we cannot do much more in terms of definitive treatment in the immediate. So that's why we encourage that when people have these chest pains, or a chest pain that is on and on for more than 20 minutes, they should see a doctor. They should see a doctor. The doctor will then go ahead and do 1 or 2 other investigations to determine whether is that or it is not, whether it's a heart attack or not. In other climes, in other countries, there is an emergency service, ambulance service system, emergency medical service system, where when patients have these things, maybe at home, at the airport, on the road, there is a number they can call. Within minutes, a vehicle will get there, or an helicopter will even get there and pick the patient and get them to the nearest hospital within a short period. But in Nigeria, we are still battling with this. So you find that a number of our patients don't arrive early enough, and so we can't help them on the second part of further definitive treatment. But if they come in at the right time, we resuscitate them, and then we determine which vessel is affected. And if we do, fortunately in Nigeria now, we have the capacity to do the definitive management, which sometimes will involve thrombolysis, using certain drugs to open up the artery that is occluded, that is blocked, or do what we call PCI, percutaneous coronary intervention, in which a wire is passed into that artery, and the clot that is blocking the artery is taken out, so the artery is opened up again.
It is now time for our feedback segment, and our first question today is, I'm 6 months pregnant. How can I be operated of fibroid and my baby will still be alive?
You should not do fibroid operation while pregnant because of risks of severe bleeding during the operation.
Our second question says, how can I get a good gynecologist?
You can get a qualified gynecologist at a certified healthcare facility.
Those were the question and answer segments, and you too can participate by sending your question and suggestion to us at yourhealthnta@gmail.com. I take it again, yourhealthnta@gmail.com. And it is on this note we conclude today's edition of the program Your Health, and we hope we've been able to inform you and educate you on the topic heart attack. Join us again, same time, same station next week for another fresh edition of the program. Remember, your health is in your hands, so let's stay healthy.